In the last video, we saw the different reasons why you have problems with puffy eyes, eyes that are hooded, eyes that are hollow, or the dark circles under the eyes. In this video, we'll be talking about the different treatments that we can offer you. Hi, I'm Dr. Saumil Shah. I'm a plastic surgeon, director of plastic surgery at Skinzone Aesthetics in Borivali, West Mumbai. So there are two terms that patients often come to us with. One is hooded eyelids or hooding that they see, where the upper eyelid sort of just falls on top of your eyelashes, and it makes your eye look smaller. It makes you look older, and it sort of gives you an appearance that you're not fresh and you're tired. For this, the main culprit is basically a lot of excessive skin. We have to rule out a lot of the eyebrows sort of just falling as well, because if that is the reason, we can do something what is called as a brow lift, and that can help relieve that area. However, most of the times, along with doing the brow lift, we would also have to remove the excess of the skin that is over there, which is called as upper eyelid blepharoplasty. In upper eyelid blepharoplasty, the things that we can correct are this excess eyelid skin. So we can remove that excess eyelid skin. You would get a scar that would actually fit very well into this hollow crease that everybody, even young people, have, which therefore does not become visible at all, even if it becomes dark or you're somebody who has scarring that is not very nice. Second thing that we can correct is sometimes if you may have fat pads pouting or you have some puffiness, that we can correct as well, and this again is a part of upper blepharoplasty. In the lower eyelids, if you again have excess skin, we basically remove that excess skin and put the mark or the scar right underneath the margin of your eyelid, and there again it stays in an area that is not very visible. If you're someone who has a lot of crinkly skin, or in people who want their outer canthus to be replaced higher, that is the cat eye surgery that a lot of people want, we can even do that. So these are the things that we can do for your skin, for baggy eyelids and for hooded eyelids. Now, as we said in the last video, the puffy eyelids is because of the fat pouting out. What we can do is basically remove this fat. In the upper eyelids, we remove the fat through the same incision from where we remove the excess skin. In the lower eyelids, the fat can be removed in two ways. One is through the same incision where we take to remove your excess skin. However, I do not prefer doing that. What we do is we go through the inside of your eyelid and take the skin out from there itself. So if you don't need skin removal, you may not get any scar on the front of your face, and it becomes a scarless surgery. The recovery is also faster, and we sort of give a better look, is what I feel. So we don't take a scar on the front of the face. If you have where we are to take the scar, or we have to remove excess skin from the lower eyelid and also reposition it, it helps us, but still I prefer removing the fat from the inside and just the skin from the outside. Now, if you're somebody who has hollow eyelids, along with removing this, so you may have one of these two conditions overlapping, where you may have puffy eyes along with hollow eyelids below that. So what we usually prefer to do is, along with removing that fat that is sort of pouting and causing you bags, we also take a little bit of your fat and do what is called as fat grafting in the lower eyelid area. This leads to complete rejuvenation and does not make you look hollow after removing these eyelids, which again may make you look older or tired. So that is one of the things that we can do for the hollow under eyes. Another thing is, if you don't have any other bags or you don't have any other issues and just hollowness there, we can even use fillers, which are an OPD procedure if you don't want a surgery. If this hollowness or that dark circles is because of the excess skin, that will be corrected, or that can only be corrected through the lower eyelid surgery, where we remove the excess skin and tighten the skin from the side. So these are the few things that we can do to help you out with lower eyelid and upper eyelid problems. These are of course customized to every patient depending on what they need and what problems they come with. all of them are going to have a bit of a downtime where you're going to have some swelling and bruising around the eyelids. They don't have any issues with affecting vision, or they are not going to affect you in any other way as far as your sight is concerned, because these are not eyeball surgeries but eyelid surgeries, which are very different. The chances of blindness that a lot of people are concerned about is next to nil with these surgeries. So this is the basics of what you can expect with eyelid surgeries. If you need to know more, you can get back to us, call us, write in the comments below if you have any other questions, or visit us and we would be happy to help you.